Talk to me about irritable bowel. Is that different than inflammation in the bowel?
They're definitely different. Irritable bowel syndrome is the most common GI disorder we are now seeing.
The most common?
Absolutely. And the reason is multifactorial. There are probably environmental and innate factors that cause irritable bowel syndrome to develop in individual patients, but estimates suggest that it occurs in about 15 to 20% of Americans.
15 to 20%. What are their symptoms?
So they're typically going to complain of abdominal pain in association with some sort of change in bowel function.
Is the pain enough to where they say, you know, something's wrong, I've got to get this taken care of? What's the pain like?
The pain can be mild or it can be severe, and it just depends on the patient. In the cases that are mild, sometimes patients will put up with the symptoms for a long time before they'll seek attention. If it's severe, of course, it may lead to an ER visit or an urgent doctor visit in order to get attention quickly so that they can get relief.
Abdominal pain, and you were about to say other symptoms before I interrupted.
So to be defined as irritable bowel syndrome, according to the criteria that have been published, the abdominal pain has to be associated with some sort of a change in bowel function or some relationship to the act of having a bowel movement.